Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Have a day and welcome back to the Healthy Living edition of KUM News Extra. If you're just joining us, we're talking about trouble in the womb, fibroids, and endometriosis. Let's get now to some of our viewers' questions. Doc, Judy from Agana asks, what is the cost for treatment of endometriosis?
Great question. Most of the time, the endometriosis pain can be controlled with anti-inflammatories such as Motrin, ibuprofen. If not, then we go to birth control pills to try to control the hormonal picture there. If that doesn't work, then there are much stronger, more expensive medications. Birth control pills around $25 to $30 a month, Motrin $10 a month. But if you're taking those more expensive medications to regulate your hormones, they can run up into the several $100s per month, and it can get quite expensive, as can surgery. So of course, again, we try to take care of things when they're small and less costly.
Okay, Tracy from Laddie Heights asks, what is a myomectomy?
A myomectomy, okay, a myoma is the medical term for a fibroid, which is that tumor inside the uterus that we were talking about. A myomectomy is when the surgeon cuts it out, and that would be a gynecologist usually. And there's several ways they can do that. If it's small, they can do it through a laparoscope, sort of keyhole surgery. They can do it through laser. They can also sometimes just block off the blood vessel that feeds that myoma or that fibroid, so that basically it's starved of blood, and then it shrinks and shrivels and dies. And that's a nice way to do it. And sometimes a hysterectomy is required, but we try to avoid that as well.
Okay, Jessica from Manila writes, can fibroids run in my family?
Yes, they do actually run a little bit in the family. There are some hereditary factors. Obesity also tends to promote more estrogen, and you'll tend to develop fibroids if you have that. Whereas having children tends to reduce the chance of getting fibroids.
Interesting.
Yeah.
Linda from Santa Rita writes, are there any foods to avoid or other natural treatments to ease my symptoms?
I wish I could tell you that there is a good way you could do that naturally. Stress reduction would be very important for both fibroids and for endometriosis. When women are very stressed, they will experience symptoms in their womb. For example, very severe, horrible periods. The growth of fibroids and endometriosis will be much worse. So there is a mind-body connection there, and maintaining your well-being mentally is very important. But as far as any foods, I don't have much advice there.
Okay, and Selena from Agana asks, is it true that a hysterectomy is the absolute cure for fibroids?
Well, if you don't have a uterus, you don't have any fibroids, that's true. But that is a large surgery with some risks, and it would be a last resort.
And let's talk a little bit about some of those risks associated with a hysterectomy.
Yeah.
And you mentioned trying to avoid that and letting a woman get to menopause so that that way the fibroids would go away themselves. But if a woman can't wait, what are some of the problems associated with hysterectomies?
Well, first of all, if the woman already needs a hysterectomy, she must be bleeding very severely. She must be very anemic maybe, and having a lot of pain. And then in that case, the hysterectomy is a relief for her. But it is a major surgery requiring a couple of days in the hospital afterwards. Sometimes quite a lot of blood is lost. Even transfusions are necessary. Mm-hmm. In the hands of a good gynecologist who does many of them, she's safe. But still, it's not a minor surgery.
Okay, anything else that you'd like to add about this topic, about fibroids or endometriosis?
I think it's just important if women would please get a checkup at least couple of years, where a doctor takes a look inside and feels your uterus to see if it's bulky or enlarging. That's a good way to prevent problems.
So you would know through annual pap smears?
Yeah, annual pap smear.
Okay, Doc, thank you so much again for joining us. And Dr. Lom will join us in studio next week when she'll be discussing anxiety and stress. Remember, if you've got a question, make sure to post your question on KUAM.com, or you can visit us on our Facebook page.